Welcome. We wish to start by thanking the Premier of the Western Cape, Alan Windey, and his lovely wife, Tracy Windey, for providing the Organ Donor Foundation with this wonderful opportunity today. Thank you to Capital Legacy for sponsoring this event and making it possible. Thank you to our esteemed guest and their partners present tonight. And last but not least, Pippa Hudson from Cape Talk. Tonight we are asking, why? Why should our loved ones die when it is so easy to do something about it? Why? Despite that the first heart transplant in the world was performed by Professor Christian Barnard in 1967, and we have world-class specialists and facilities, South Africa remains one of the poorest performing countries in the world when it comes to consent toward organ and tissue donation. Why? If there are more than 500,000 deaths every year, of which 12% are of a violent nature, then why do we still have a consent rate of less than 100 of the 60,000 potential deceased organ and tissue donors? Is it so hard for South Africans to say yes to consent for organ and tissue donation? The answer is complex, and the challenges of addressing it are extremely difficult. There are, however, two ways to address this problem that would have an immediate impact. Number one, an extensive network of procurement officials. Number two, public awareness and education. Let's explore option one, which is to have an extensive network of procurement officials, who ideally are medical professionals that are immediately available at trauma centres to act when a potential donor is identified. This is the most effective way to obtain consent. However, this option is very expensive due to it being a resource-heavy process requiring substantial, sustainable financial security that neither the private or public sector can sufficiently support at present. A good example to illustrate option one would be Spain, who enjoys the highest consent rate in the world. The model in Spain is ideal due to there being 480 procurement officers, of which half are medical doctors. In contrast, South Africa has only 22 procurement officers. The expense to set up an efficient network to bring about change would be prohibitive and is therefore not achievable in the short term. The remaining solution would be option two, which involves intensified public awareness and education. This is where the ODF fits in. Who is the Organ Donor Foundation? What is our role? The ODF's role is organ and tissue donor awareness to the general public. Our aim is to encourage South Africans to register as donors and to encourage loved ones to give consent toward organ and tissue donation. But what is consent? At the time of a loved one's death, the family will be approached and asked if they are willing to donate their loved one's organ and/or tissue. It needs to be noted, however, that the ODF is not a medical organisation, and we are not responsible for organ procurement or organ allocation. But a bit of history first. The ODF was established in 1988. In 2011, the executive management was taken over by Samantha Nichols and Jooste Vermeulen, and the board of directors changed to a board of trustees, who function in an overseeing capacity. Since 2011, the ODF has grown by 684%. We've increased our staff by 600%. We now have 1,200 volunteers working throughout South Africa. There are two branches to our activities: public education and public awareness. The first branch, public education, is achieved through the Leeuwenhoff project and is directed where it is most needed. It involves face-to-face educational programs at schools, clinics, and state hospitals in under-resourced areas. The second branch, being public awareness, involves driving organ and tissue donor registrations to those who already know about transplantation. During the past 3 years, the ODF has achieved a staggering 432 events. In addition to the high number of awareness events and educational programs, we also reach South Africans through the media. During the past 5 years, the ODF has achieved 115 million of free media coverage. We have reached South Africans 872 million times. 872 million times. This means that each South African was reached at least 15 times. In spite of this success, we are aware that we did not reach every single South African. Frustratingly, this means that we reach some South Africans many times, and others not at all. Why then do we only have 300,000 registered organ and tissue donors on our registry, when we could have 1 million registered donors? We have successfully increased our media coverage. On average, we have 3 awareness events per week nationally. The Lunchi project has educated thousands upon thousands of clinic and hospital visitors and school learners. We have shortened the registration process to reduce drop-offs. We have a successful social media presence with over 100,000 followers. Surely the number of people who register should be higher? Yes, we believe it should be. And that is why we are here tonight. You can make a difference without even having to give us a donation. Yep, we are not asking for money. Plus, if you see how easy it is to help us, you would surely action it. This is the plan. Despite our many successes, we are still faced with limitations. We do not have the resources or the technical platforms to reach as far as we need to. However, you do. You have the power to help us overcome limitations and to get on with the business of saving lives. Every day, we frequently log into a program or application to conduct a transactional service. We daily log on to banks. Not only banks, but also hotels, airlines, SARS, to purchase tickets, online shopping, and many others. Yes, surely during these transactions, it wouldn't be inconvenient if a pop-up window appeared and asked, "Do you want to register as an organ and tissue donor? Yes or no?" All it takes is a second to select yes, and the name and contact number will automatically be posted to the ODF, who in turn will phone and quickly register you as an organ and tissue donor. Voila! You will receive your personalized organ and tissue donor card shortly. So let us, again, ask why. Why should our loved ones die when it's so easy to do something about it? And this is what you can do about it. Your organization can implement this action, either via your company login facility or at front desk where customers book in, or better yet, both. What about infrastructure? The ODF has a robust database process in place with a fully developed API interface for smooth and easy integration with your networks. We're not asking for your money, we are pleading for help. Help us to enable us to save lives.